We all know that when we look at AI, it is truly redefining healthcare, offering new possibilities for diagnosis, treatment, as well as patient care. But the big question again being is how do we harness it to its fullest potential? So to shed more light on this, we in fact have a leading expert in AI and healthcare from Google DeepMind. We in fact have Aparna Taneja, who's about to take us through a quick set of presentation, her own set of insights that we're about to gather. And this time, the industry that we are focusing on is to do with healthcare. So we're going to do that, and we're going to get started within the next couple of seconds. Ladies and gentlemen, we have with us Aparna Taneja.
In a country where TB, lung cancer, and breast cancer diagnosis remain a challenge due to a shortage of trained radiologists in remote areas and limited screening access, AI can address these issues by interpreting chest X-rays for TB signs, aiding lung cancer screening, and assisting radiologists in interpreting mammograms for breast cancer detection, making these services more accessible and improving early detection rates. Apollo Radiology International is an example of this. They are attempting to reduce high mortality rates due to respiratory diseases and cancer using Google Cloud's platforms and AI technology to support its mobile screening program. This technology supplements radiologists' expertise, not just detecting early signs of disease, but also helping healthcare professionals process more scans than ever before, thereby helping equalize and scale access to specialty services, especially in the country's most remote and vulnerable regions. Over the next 10 years, Apollo Radiology International will use these models to provide 3 million free AI-powered screenings for TB, lung, and breast cancer diagnosis, helping hundreds of thousands more people access timely care across India. In fact, TB detection is being approached from multiple dimensions with AI. Salsic technology, using cough sounds, is exploring using Google's health acoustic representations model, trained on 300 million pieces of audio data to help advance research and detection of tuberculosis. All of this said, the vast majority of ailments we experience are in fact predictable. There is a strong correlation between a developing country's typical standard of living, environment, and tropical climate with diseases like diabetes, cardiovascular diseases, and hypertension. In fact, health challenges like gestational diabetes and iodine deficiency for expectant mothers are again typical in warm developing countries. Further, our unique climate and ecology predisposes us to seasonal dengue and malaria outbreaks. They happen every year and are therefore predictable. In this scenario, AI can analyze vast troves of data, predicting outbreaks and identifying high-risk populations before diseases strike, empowering public health officials to intervene early and effectively. For example, Arman, which is an NGO that has been dedicated to improving maternal health outcomes across India via mobile outreach, is using AI to help new and expectant mothers stay engaged with information vital to their pregnancies and the health of their babies. Using Google's AI-powered predictions, health workers are able to follow up with women who are at risk of dropping out of the health program. In the medical research space, AI can hugely accelerate research by rapidly processing the enormous data sets required for breakthroughs in areas like gene editing and genome sequencing, potentially leading to faster drug discoveries for life-threatening diseases, and as yet incurable diseases like AIDS, cancer, liver cirrhosis, and a host of newly emerging autoimmune disorders. From easing the burden on our healthcare professionals and empowering them with advanced diagnostics, to enabling timely, proactive interventions through data analysis, AI is poised to make healthcare more efficient, accessible, and patient-centric. The true measure of success, however, lies not just in the technological advancements, but in the tangible impact it has on people's lives. The young mother receiving timely care for her child, the senior citizen managing their health with ease, the communities protected from preventable outbreaks. These are the stories that will define AI's impact on India's healthcare landscape. While AI is not a magic bullet, it offers a powerful set of solutions to address India's healthcare challenges. By harnessing AI's potential responsibly and ethically, we can create a future where quality healthcare is not a privilege, but a right for every Indian, regardless of their location or circumstance. Thank you.